When I was 7 months pregnant, I was told my baby would be a girl and likely wouldn't live to be born. If she did, her life would be brief, days, maybe hours. A perinatologist told me this, using what she assured me was the most advanced technology available. It made her certain. It made her confident of the rare diagnosis, and it made her completely disconnected from what her words meant to me. She told me to come back in 2 weeks. Over the next days, it was hard to know what to wish for, really. Actually, it was hard to do anything at all. I binge watched The Sopranos on VHS. Thanksgiving happened. I gathered second, third, and fourth opinions and was told, again with the use of technology, that maybe things weren't so bad. I remember the exact words. This is a moderate situation. So, 3 days before Christmas, an hour or two after a small earthquake, my baby was born. A boy. Amazing how quickly everything turned from pink to blue. He had challenges, to be sure, but the forecast of devastation was not accurate. Most of the next months were really just kind of standard baby raising days, with a few extra doctor appointments tossed in. Then, when Gabriel was 4 months old, he was diagnosed with hydrocephalus, the result of a stroke that happened before he was born. The shadowy remains of the stroke could be seen on the CT scan, and advances in genetics explain that the stroke had happened because Gabriel inherited from me genes that made him prone to blood clots. Technology told me a lot about my little son. A neurosurgeon placed a shunt into Gabriel's brain to treat the hydrocephalus. A primitive device, but the most advanced and only option. And again, the standard baby raising days came back until he was 20 months old, and he became very suddenly very sick. After we had spent several scary, awful days in a Reno hospital, I drove us here to Stanford's Children's Hospital. Here, Gabriel was surrounded by the most advanced machines, brilliant minds, and innovative best practices that medicine had to offer. There was no place he could be safer. I felt so relieved and totally wiped out. Gabriel's breathing and heartbeat were being closely monitored. Every time he would make the slightest little wiggle, the alarms would blare. Every time we would almost be asleep, the racket and the worry would begin again. And the nurse, she could see how tired we both were, and she wanted to take care of me too. So she did the logical thing, the logical, compassionate thing. She turned off the sound on the machine next to his bed, and I thanked her when she did it. I was so grateful for the thought of actually being able to sleep. Later, I would be told that unknowingly she had actually done a lot more. She had turned off the alarms everywhere, next to his bed, on her pager, and at the nurse's station. And the manufacturers, they later explained that they didn't think anyone would go through the trouble of navigating through 7 screens to turn off all of the alarms. So they didn't go through the trouble of including a failsafe that could have stopped her. By failing to compensate for the genuine and appropriate compassion the nurse felt for my son and for me, the technology failed all of us. So when Gabriel's shunt stopped working and his heart stopped beating, there was no sound. Advancements in research and technology will never overcome the fallibility of the human element. We humans, we're just too beautifully flawed. All machinery that we encounter, we filter it through our paleo-mammalian brains, the part of our brains that give us intuition, emotion, and memories. Our human systems give us what we most want in healthcare: compassion, connection, and hope. And it also gives us what we least want: fear, frailty, and confusion. Because of this, 0 elements, 0 errors in healthcare is an unrealistic goal. It doesn't mean, however, that that gives us an excuse not to try to make things better. What it does is it gives us a mandatory obligation to be ready when things go wrong. And I ask you, to consider, if you will, what you will do when things go wrong. Right after you call your lawyer, because I know that's the first thing you're going to do. What will you do when the human element trumps your technology? When our ancient brains override your user's manual? When your best intentions, work, and effort are not enough? And what you least want to imagine actually comes to be? All of that goodness you have created, all of that work, effort, and intention will all be erased if you do not do a good job of handling the fallout of errors. When the people who are involved in errors, everyone, the patients, their families, the clinicians, everyone, when these people are not treated with compassion and honesty, they are further injured, cut and infected all over again. Disclosure, transparency, and compassion should be the standard of care for handling the unexpected in medicine. By disclosure and transparency, I mean telling the truth and being accountable. Transparency is not the view of an event from 30,000 feet above, where shapes are fuzzy and details are impossible to see. Transparency is the view from the ground. It is look me in the eye and explain to me until I stop asking questions. Transparency is information democratized, where everyone has access and everyone is heard. How have we gotten to a place where telling the truth is considered bleeding edge innovation? I think we can do a lot better than that. How is it that hospitals being transparent after the unexpected happens is considered revolutionary? It should be mandatory. And extending care to the people involved in errors, this should not be exceptional or heroic. It should simply be done as good patient care. Compassion. Compassion is easier to describe than transparency. And I ask you a single question to help you define compassionate care. How would you want to be treated if your child died because of a medical error? Let that thought guide you. And if it's not enough, call me. I'll help you. Essentially, the monitoring equipment failed because the manufacturer didn't fully understand the environment where they placed their machines. They didn't consider an overworked, motivated nurse who would simply want to make a situation better for her patient. And they ignored the human variable, even the most obvious, our need for sleep. I am sure all of that equipment went through very extensive testing. Listening to heart sounds is very high-stakes business after all. Yet it didn't pass the muster of human interaction, and that rendered it useless. If you're looking to change the world, please do something about this. 400,000 people die in US hospitals each year because of preventable mistakes. This metaphor has been bounced around a lot in the last couple days about the planes crashing into the ground being an equivalency somehow. And it's true. Two jets full of people crashing every day is how many people die in the US every day because of medical errors. And that means every day there will be 400,000, every year there will be 400,000 people who could get up on a stage like me and tell you about losing a loved one. And more than 2 million who could talk to you about being injured. That's a whole lot of sadness and tragedy, and I doubt any of us could endure sitting through that. It would have been easy, expected, typical really, for Stanford to go silent and ignore me after Gabriel died. But they didn't do that. Instead, they sought to collaborate with me. They didn't prey on my vulnerability or lack of legal understanding. And they could have. They really could have just counted on me not being able to gather myself enough to file a lawsuit within the statute of limitations. And they probably would have been right. I wonder sometimes if someone knew about that dangerous situation in the machines, if someone deliberately chose not to talk about it. And this is where the opportunity really lies, is by being transparent after the unexpected happens. We can find the deadly system errors and we can act to fix them. After Gabriel's death was investigated, all other hospitals using the same equipment were alerted to that deadly potential. Maybe that helped somebody else. I'll never really know. Technology and research, it will continue to push us forward, giving us medical miracles. And we have seen many of them here in the last few days. Now, along with these terrific advancements, healthcare needs improvements in compassion and transparency. Because we humans, we don't move along at the same pace of machines. And we don't have easily upgradable operating systems. And this is why we need to learn to operate and work within the limits of our human imperfections. Our humanness will continue to give us tremendous triumphs and inevitable tragedies. It also gives us the drive to make things better when we fail. Thank you.